Welcome back to Capitol Review. President Trump is calling on the CDC to overhaul the childhood vaccination schedule. He signed a new executive order calling for that change in medical guidance.
It's not only that you're doing fewer vaccines or jabs, as they say, but you're doing them in a series of visits to the doctor, much smaller amounts.
The idea already getting a lot of pushback. Public health experts are raising concerns that could lead to an increased risk of kids becoming infected with vaccine-preventable diseases before getting all their shots. Meantime, health departments in the DMV region are responding to the president's executive order. The Virginia Department of Health says that nothing about the president's executive order changes vaccine recommendations or school immunization requirements in the Commonwealth.
The evidence supporting that schedule is extensive. We remain confident that it's one of the best ways to help protect children from serious preventable diseases.
BDH says if parents have questions about vaccines, they should talk to their child's pediatrician. Meanwhile, the Maryland health officials are saying in a statement in part, quote, the Trump administration's intention to change the federal vaccine schedule for children circumvents long-standing scientific process experts use, adding that Maryland school vaccination requirements are reflective of our policies and remain unchanged. Well, joining us is Ashwani Jain, a Democratic political strategist and also author of Project 2027, a blueprint for Democrats to regain control of Washington. Ashwani, welcome back to Capitol Review.
Thanks for having me back on.
You know we're always glad to have you. Let's get right to it. Your reaction to the Trump administration's vaccine recommendations.
Well, look, a combined MMR shot has been used safely for over 50 years. And breaking it up like the president now wants to do does not protect kids. It actually means more disease. As a cancer survivor myself, I care about real wellness, but grounded in science, not conspiracies. Vaccines work. That is not an opinion. It is a fact that is backed by over a century of science. And while the president publicly attacks vaccines, he's always got them himself. Look, at the end of the day, Republicans love sounding alarm bells about toxins and cancer rates, but then they slash FDA oversight, they weaken environmental protections, and then they gut the NIH and CDC funding. None of those are making us any healthier or safer.
Well, Ashwani, Senator Bill Cassidy, the Republican chair of the Senate Health Committee, slammed the executive order in a social media post saying that vaccines are safe and don't cause autism. Is this bigger than politics?
It is, and he's completely right. Look, when Trump's own FDA, his own CDC, and NIH disprove his lies about vaccines, or when a majority of Republican leaders cry about heavy metals in food, but then approve pesticides containing forever chemicals, or even dismantle the agencies that are responsible for keeping our food, our water, our air, and our medicine safe, you have to ask what is going on. You cannot claim to care about public health while also spreading misinformation or even encouraging people to avoid taking vaccines that work. Real leadership at the end of the day means listening to the doctors and scientists, not overruling them based on conspiracy theories.
Ashwani, let's switch gears. You have the moderates and the progressives in the Democratic Party and what some describe as a tug of war. Can they find the same messaging as we head into the midterms?
I really hope that the establishment gets on board. Look, all that progressives are asking for is that taxpayers have the same basic security that our politicians enjoy. Affordable health care, paid family and medical leave, affordable housing, and a living wage. And the thing is, we already pay for these as taxpayers, but that money keeps getting funneled to corporate bailouts instead. And ironically, red states depend on these socialist programs a lot more than blue states do. Look, the real question is not capitalism or no capitalism. It's who the system is working for. You can become a millionaire while workers have health care and living wages. And in fact, businesses benefit when workers have these. And so the goal is not to make rich people poor. It's to make sure that working people are not poor in order for someone else to be rich. That is all progressives are campaigning on, and that ultimately is a winning message.
It's all about the kitchen table discussion.
Absolutely. It's about affordability. It's about accountability. And that's why you see a lot of these progressive younger candidates beating longtime establishment Democrats in primaries all around the country, even in swing states. And if the establishment really wants to win in this, general election, they got to get behind that message.
Ashwani, can progressives win in some of those districts where it's going to be tight? That's the question a lot of people are asking.
Yes, they can. We just saw it with El Sayed in Michigan, a very swing state for a U.S. Senate position. You're seeing it in New York. You're seeing it in states all around this country where you have these younger candidates and also just candidates who, again, are talking about these kitchen table issues and are not afraid to be bold and progressive on issues that are popular with voters, like Medicare for all, like a ceasefire in Gaza, like supporting human rights. These are all issues that affect all of us taxpayers. And if you get behind that message, you will win, and you will see also increased turnout in all elections up and down the ballot.
Ashwani Jain, thank you so very much for joining us.
Thank you so much.